You know, prostate cancer is something, unfortunately, that I know a lot about. I went through it a few years ago, and my doctor, through my process, is in studio today talking about Dr. Austin Lutz. He joins us now in hopes of creating a little bit more awareness for this treatable cancer. How you doing?
Doing great.
This is my guy right here. I owe him a lot. Trust me on that. So how you doing?
Doing good.
I'm doing good as well. I want to know, because of what I went through, I kind of know, but how common is prostate cancer?
Very common. So about 1 in 8 men will have prostate cancer, be diagnosed with it. The fortunate thing is most of the prostate cancer we find will not be life-threatening as long as we're catching it pretty early, which we typically do.
Yeah, and that's a screening procedure. When should that happen? How often, or what?
Great question. So kind of the most recent guidelines would say around 45 to 50 for guys without risk factors. African-American guys with a family history, probably in that 40 to 45 range, you know, and then based on some different risk factors and those numbers, then we kind of go there annually or maybe a little bit less frequently until they sort of reach 50 and then certainly annually thereafter.
Yeah, my PSA number was a red flag for me, but people talk about symptoms. I didn't necessarily have any, but are there symptoms?
There typically aren't. I mean, fortunately, if you talk to some of my older colleagues, they talk about prostate cancer when it was very advanced, but with PSA screening, we've kind of gotten ahead of that curve. So usually we don't see it unless it's very advanced. So it kind of underscores really the importance of being screened.
Yeah, and when it comes to this, the treatable options, we know between you and me that I had surgery and I had my entire prostate removed. That's one way, but there are other ways, and you brought those up to me during our discussion.
There are, absolutely, and really it's a kind of a discussion between you and the patient, kind of a risk and balance and benefit, you know, option and what's important to a patient. But surgery has certainly been around forever and very effective. Prostate radiation, so radiation to the prostate, is also extremely effective. Radioactive seeds have been around forever and very effective. So there are some other kind of off-the-cusp things that are out there that we're certainly exploring, but those are sort of still the three mainstays of therapy, and outside of clinical trials, most of what's being done.
Yeah, and we did have a discussion with that, but you also encouraged me to talk to people who might have gone through it to get some of their reaction. That's something that people need to take into account, right? Absolutely.
Yeah, I think leaning on people who have had experiences already with any of the various modalities, or even active surveillance, even just watching it, I think having support is certainly helpful.
Yeah, and we talk about cancer, but you said 1 in 8 get it, but let me tell you something, I'm a survivor of it, have no issues to this day. If you catch it early enough,
yeah, yeah, you can certainly treat it.
Yep. Austin Lutz, Dr. Austin Lutz with the Urology Centers of Alabama right here in Homewood. We appreciate the time. Yeah. And again, I can't thank him enough. So thanks very much.
Appreciate you.
You bet. You bet.